Hello and welcome everyone. My name is Michelle James and I am the Senior Director of Alumni Engagement at the Emory-Rollins School of Public Health. Today, we're excited to launch season 2 of our webinar series, Our Public Health Future Starts Now. It was created by our Rollins Alumni Board, and series explores the intersections of innovation, technology, and public health. Through this series, our hope is that we can inspire new ways to think about technology and innovation and how it relates to public health, and perhaps inspire some new career paths for our alumni and students and public health fellow professionals. Our sessions last season highlighted advances in technology and explored how we use such advances to help shape the future of public health. We discussed how we can use data, biotechnology, algorithms, generative AI, satellites, etc., to expand how we address things like outbreaks, climate change, healthcare, and a variety of other public health challenges in new ways. In today's session, we're talking about how AI and how it's revolutionizing, industries and public health today. We'll explore real-life examples of how companies deploy AI to drive innovation and enhance customer experiences, along with the most valuable AI applications and tools. At this time, I'd like to turn the program over to Niles Friedman, Rollins alumnus and president of our Rollins Alumni Board, and the driver behind this series. Niles is the founding executive advisor with Star Insights, where he specializes in creating and growing business divisions and core functions within organizations. In his role, he works to build strategic collaborations across all sectors, industries, and geographies through his work with startups, C-suite executives, public sector administrators, and nonprofit leaders. Niles, I'll turn it over to you.
All right. Thank you, Michelle, and welcome everyone to this series. We're really excited. This is our second season. As Michelle mentioned, we had a really strong first series of sessions in 2023, 2024, and this is our first one for season 2. So we're really excited to get this kicked off and started. We've got an amazing presenter. Asa is a current board member as well, so a peer and a colleague on the alumni board, and has just made an absolute great first impression as a board member, just jumping in on many different things. And one of these is around AI. So really excited to get into that conversation today. A few things I just wanted to mention. We have 2 additional sessions that we have confirmed for the next month. One is going to be around innovation and entrepreneurship, and really tapping into some of the Emory resources like the hatchery that are in place for students. But we wanted to really elevate this idea of like what that means to be an entrepreneur. What are the innovative resources that are available at Emory and outside of Emory for alumni to think about as we start thinking about starting a business potentially. And then we've got a really cool session that talks about the value of an MPH in the context of something that is very prominent within the tech sector, which is human-centered design. This is something that public health professionals have been focused on for decades, but it's getting a different level of visibility, specifically in the tech sector. So we're really excited to talk about what that means and how having an MPH is really valuable to that type of work. As far as the session today, we really want to keep this focus on like, what is AI? What does that mean? What does that mean for public health? What does that mean for you as you think about your current career, your current job? But as you start to think about it, and Michelle mentioned that there is definitely a revolution happening around AI. And, when you think about that, it's always helpful to sort of ground it. What's the practical reality of what that means for an alum or for a student or for a public health professional? Because then you can better discern, like, what does that mean for me when I think about my day-to-day job? Or if you're really interested in this space, what are maybe some career opportunities that I could focus on potentially in the future? So why don't we dive in? Asa, as I mentioned, is a current board member, but brings this really amazing, diverse background. And would love for you to just kind of give us a little bit of your story coming out of Rollins and how you landed in this AI space.
Sure, yes. So believe it or not, I'm an ex-physician in a past life. I went to med school. Something interesting that I tell everybody is I got into med school at 17. In India, you're legally allowed to drive at 18. So every morning, my dad would drive me to med school and I would cut open a human brain. And I would tell him, like, either I should not be cutting open a human brain or I should be allowed to drive. Really enjoyed my time during med school, applied to Rollins, got my master's in public health. hands down, 2 incredible years. Everyone made me feel so comfortable. It really eased my transition into the US. After that, I actually stayed on and worked at Emory for almost 3 years. That was right when the Affordable Care Act or Obamacare Act had gone into passing, and Emory was doing a lot of cool things as part of that. So we were bringing 2,000 physicians under the Emory umbrella all across the state of Georgia and Florida. And I was sort of helping with that initiative. I decided to go get my MBA. For my MBA, I went to MIT, really enjoyed my time there. And that's when I made a pivot into retail and the tech space. Since then, I joined McKinsey, which is a consulting firm, again, serving tech clients, worked at CVS, DoorDash, and currently I work at Walmart. In the last couple of years, it's been very heavily focused on the ML AI space. So it has been quite an unconventional journey. But everything's built on each other. And now when I look back, the dots definitely connect. But if you told me when I was getting into med school that I would be working on AI models for a
Right, right.
I would have told, like, I don't know what you're talking about. So careers have a
Awesome.
funny way of panning out.
I just love that point, right? Sometimes if you look back, I have the same kind of experience looking back at Rollins. If you had said, hey, you're going to be doing this work over your career, I wouldn't have put those dots together, but there is a clear line. You can see it kind of builds on itself, which is great. Um, As I know you're going to jump into some of the slides, and just for folks that are on the webinar, we've got two ways for you to engage in the discussion today. We've got a Q&A, so if you have questions, please add those in, and then we have an active chat as well. So looking forward to getting some active engagement from everyone on the webinar today.
Awesome. Can everybody see my screen? Is the PowerPoint up?
Yep, I can see it.
Okay, perfect. So before we dive in, I do want to start with a disclaimer, right? Give me a yes in the chat bot if you remember the days of the internet where either you could have your phone connected or you could have internet. And if someone called you, your internet connection stopped. Is there anyone who remembers the era of dial-up internet back in the 90s? Okay, I see some yeses. So basically, back in the day when internet launched in the early 90s, if someone had told you one day we will be sharing our cars with strangers, aka Uber, Lyft, we will be sharing our homes with strangers, Airbnb, you will have friends across the world, Facebook, we will be sharing our pictures with the entire world, Instagram, it would have been very hard to connect the dots. But it has taken us almost 2 decades, 2.5 decades from when the internet launched to see the full potential of what the internet has enabled. Internet launched in a way in 1995. In a huge way, AI came into being with the launch of ChatGPT about 3 years ago. What AI is going to do in the next 2 decades, most of us can only guess or predict. And if anyone comes to you and says, hey, I'm an expert, listen to me, this is what AI is going to do in the next 20 years, take it with a pinch of salt, because that would be like someone sitting in 1995 telling you this is how internet is going to impact your life. We can take educated guesses, sure, right? Like remember pets.com, amazon.com, match.com, all of those started in late 90s. So we can take educated guesses on how AI will transform industry over the next 2 decades, but nobody can definitively say that because this technology is just as powerful, if not more, than the internet. So with that disclaimer out of the way, I am no expert. I'm sharing what I know best with you today. Let's talk about, most of us have heard this, right? AI is going to change the world. Every CEO during earnings call is talking about it. But when you talk to most people and you ask them, like, tactically, what does that mean? How is my day-to-day life going to be changed as a result of AI? Like, sure, I'm using ChatGPT, but how is that changing industry? How is that changing the world? Today, we're going to talk about two things. One, a very clear understanding of the 5 AI technologies that make up and define the AI landscape. Like, we need to understand at its core what these means. And then how do you deploy AI in your own context, right? Whether you're working as an epidemiologist, whether you're a biostats major, How do you take some of these learnings and deploy them into your space? With that, let's start with machine learning, right? Most of us use our phones, have used Instagram. If you think about your Instagram, it basically starts out as a blank feed. It's blank boxes. What gets filled in these boxes is extremely personalized to you, right? Have you ever had that moment where you're like, I was thinking about these shoes and now they're all over my Instagram feed? And at its core, that is a really good ML model. And when I think about an ML model, I often think about, funnily enough, my dog. He is someone who, I'm Indian, I eat a lot of Indian food. Anytime I'm eating something spicy, he will not come next to me because he knows I'm not going to give him anything. If I'm eating something like bread or a baguette, he will come and he'll put his head down on my lap and he'll be like, give me some. In a way, that is a machine learning model at its simplest. He has understood the smell of a particular food. He's understood that when he looks at me with doe eyes, puppy eyes, I give him stuff. That is his machine learning model. Think about the Facebook machine learning model as the exact same way, or any machine learning model. That could be Amazon and what it recommends. These at its core realize how you engage with certain pieces of data, and then they feed you more of that data. So when you think about machine learning model, it's basically at its core, looking at huge amounts of data, learning from it, recognizing patterns, and making predictions. Where can this apply in public health? Think about diseases. If we could look at various symptoms and we could analyze mass amounts of data, how much better would we get at predicting outcomes, right? There's a clear correlation in taking these advanced ML models and applying them to the public health space. Next, let's talk about neural networks, right? We're going to talk about two people, John and Tim. Both of them were recently laid off as part of the tech layoffs. John is someone who is generally an optimist, right? He decides, okay, I was laid off, but I'm going to look at this and make it the best decision I ever could have. He decides to work out. He updates his resume. He decides to make a career pivot. He decides to go join a new job, which is really fulfilling for him. He takes an adverse event and turns it into something really positive. And Tim, on the other hand, he gets depressed. He does not apply to new roles. He sits at home and thinks that, hey, it's really hard to get a job right now. He wedges out in front of his TV. He eats a lot. And then that becomes a self-fulfilling prophecy, right? Both of those two people, John and Tim, were faced with the exact same circumstances, but they reacted very differently. And why do you think that was? That was because there's a neural network, right? Each of us have. That could be our belief systems. That could be our upbringing. That could be how we view the world. That could be our inherent nature. All of those things contribute to how we react to the world. When you think about an AI model, most AI models, advanced AI models, run on neural networks. So they have an input layer where we feed them data, aka John and Tim getting this letter which says, hey, you no longer have a job. That was an input. They have a lot of hidden layers which we do not see. That is not hard code, which is why it's so difficult to convince an AI model to do something, right? Because just like a human being, they have neural networks, they have made connections. So you can nudge an AI model, but you cannot go in and code something and inherently change how it runs. AI models are very similar to human beings in terms of their neural networks. So they get an input, there's a lot of stuff that is hidden, we don't know what connections they made, and then they give you an answer. Now, if that is freaking you out, it definitely should, because that is exactly why really distinguished AI scientists, Sam Altman, folks at the Center of AI Safety, keep talking about, hey, AI is something that poses a threat to humanity as a whole because of the neural network. We do not know what is going on in the black box that is the neural network of an AI model. Now, let's talk about LLMs, right? When ChatGPT burst onto the scene, everybody was like, hey, this is so amazing. And suddenly AI became the hottest thing on planet Earth. But we've been using LLMs for a very long time. At its core, at its simplest, An LLM is an autocomplete feature, right? If you've ever used your iPhone, if you've ever used an iPhone, or if you put something in Google and it's given you a sentence, it was working off of an LLM. So we've had access to this technology way before ChatGPT. ChatGPT just did it in the swankiest, fanciest, most amazing way possible. And just the way LLMs for Google can go wrong, they do go wrong for ChatGPT. An example of that is dinosaurs were made up by the CIA to discourage time travel, right? That is an example where it predicted a whole bunch of words which didn't make sense together. But we've had this technology for a very, very long time. Now, let's talk about the two buzzwords, which are AI and Gen AI. Right now, everyone talks about like, hey, this is an AI model, this is a Gen AI model. But in its truest form, right, AI and Gen AI models are those which mimic or are very similar to human cognition, right? They can think, they can feel, they can reason, they can problem solve. We are in the beginning phases of this, but we haven't actually seen that worldview where we can tell them a problem and they'll solve it. Sure, they can give us text and they can tell us here are the 10 steps you need to take. But if you give them a problem like, hey, I want you to find a cure for cancer, right? That requires way more cognitive reasoning. It requires looking at data, making interpretations the way labs do, research labs do in public health. That is something that AI and Gen AI models are not fully there for. They're good at ML, which is looking at vast quantities of data and making predictions, but truly thinking the way a human would when it comes to solving cancer, we're not there yet. We will, hopefully, but not just there yet. And Gen AI right now is much more focused on generating it in terms of text and image and audio, right? Like if you use Midjourney, if you use Sora, you can get pictures and videos. We're beginning to start to see some videos, audio, which is created by an AI model. So that is an example of sort of a Gen AI model. Now, before I show you the next slide, anyone here watch Terminator? Give me a yes in the chat if you have. So this is the thing that we are actually scared of. If you watch Terminator, right, he could think for himself. He could reason for himself. And at its core, he could make decisions based on his or her self-interest. And when we think about artificial general intelligence, that is what we are talking about. The ability for an AI model to reason, to rationalize, to make decisions, to think in its own self-interest. And that is scary for humanity, right? Because that AI model might decide, hey, I want to focus on what's right for me, not for the greater good of humanity. AGI is sort of going to eventually come. In what form and shape it comes, that is a TBD. But that is sort of the heart of what Elon Musk talks about that worries him. That is the heart of what a lot of scientists who work in the space talk about and are scared about, because we need to use this technology in the correct way. So when AGI is developed, it is a partner for humanity as a whole. So with that, let's talk about.
Hey, can I ask you a quick question on this? Because I think it's a really, I love the way you're framing this, right? All these different areas, right? And bringing the context into public health for that area within this broader space. Like, do you have like impressions or ideas for how that might impact folks that are working in the public health space or just healthcare and more broadly?
So each of these, like the LLMs and AI and Gen AI, like how would those impact, or just AI as a
More kind of the impression of how like the Terminator sort of vantage point. Like how do you think that might practically impact folks that are doing public health work? Yeah.
I think it would be broader, right? Like think
Okay.
about the fact that
Mhm.
an AI model can think way faster, and we're not there yet, right? Like we are at a higher level of LLMs. We're dipping our toes into AI and Gen AI. But AI is going to be able to think faster than humans. It's going to be able to problem solve faster than humans. It's going to be able to analyze way more data than humans can in one go. So you're
Mhm.
essentially creating like a smarter superhuman who can think, rationalize, reason faster than you, make decisions. And on the
Yep.
other side, we're building AI like robots which can move, right? Which can interact in the physical space. Now, when you combine the intellect of a model who can think, rationalize, reason way faster, and we're also building super robot, like physical robots, we're building those more from a fulfillment center perspective, right? Like you might not need a
Mhm.
nurse because you
Yes.
have a robot nurse. You might not need someone to clean a hospital because a robot can do that for you. When those two things combine, that's sort of that scary place, which we do not know
Mhm.
how it'll end up. I
Yep.
think the potential for that is immense, right? Like when I think about the healthcare setting, like there is a lot of work that happens from a nursing standpoint, which physical
Mhm.
robots can do for you. When I think
Mhm.
about it from a research standpoint, there's a lot of ML models that have been deployed to look at the data, but as they get more advanced and nuanced, you could do drug testing much faster. Like, hey, let's test drugs way faster using an AI model so they can get to market much quicker. All of those things would be ways that AI is going to influence public health.
Got it. That's great. Thanks.
So now let's talk about how do we deploy AI. The examples I'm going to share with you are industry examples, but in that, I'm going to ask you to thread the needle and connect it to AI. So let's start with the first one. When I think about deploying AI, even before I give you specific examples, I think about the strategy, right? Because AI is new technology. How do you deploy it within an industry, within a sector, within an organization in a way that works? So you break it up into two. You've got quick wins. This is stuff where you do not need to do a lot of work. You can use existing tools, existing infrastructure just to improve efficiency, to improve productivity. This is training your um, teams, it's training your organization to use these tools. And then you've got medium term wins. Here you need to personalize the AI models. Here you need to put in some engineering work, product work, dev work to make sure the model works the way it's supposed to. And underlying all of this is continuous improvement, right? We need to make sure people are being upskilled, employees are getting the training to use these tools, they are aware of the recent changes that are happening in the AI landscape. So that is sort of the strategic framework if you want to deploy AI within your organization. Now, let's start with quick wins. What are things that absolutely everybody should be doing today? We're going to start out by using AI and Gen AI tools for marketing, right? We're in the public health space, whether it's CDC, whether it's WHO, whether it's UNICEF, they go out and do phenomenal work. But to do that phenomenal work, a huge part of their budget comes from donations, right? And where do donations come from? You need to be able to effectively craft and share your story. When WHO or UNICEF, whether it's the recent war that's happening in the Middle East, right? And they want to provide support to the kids in Gaza, or what happened to the broader Middle East area. They need to be able to market what's happening and ask people to donate. PCRF ran an incredible campaign asking for donations. Core to that is a marketing team. And if you're part of a marketing team in the public health sector, whether it's hospitals, whether it's big pharma, whether it's WHO, CDC, UNICEF, and you are not using AI tools, you're missing out. Everything from idea generation and campaign concepts to creative. Like if you've not used Udio, it is great for creating AI songs. So you do not need copyright music, right? If you are launching a marketing campaign in the public health space and not using AI tools, you're missing out. It is really expensive to run efficient marketing campaigns. AI can bring that cost down dramatically. I'll give you an example from industry. So Heinz was sort of running a marketing campaign where it said, according to AI, what will ketchup look like? And AI came up with all of these examples. Imagine if they went to someone who had to draw these out. They would have to think about this idea, draw it out, color it, it would go to print. How much more expensive would it have been versus them going to an AI tool and getting this created in a matter of minutes, right? So marketing at its core is ready for disruption using AI, especially in the public health space where budgets are tight. We're trying to do so much good, but keep our costs low. So within that sector, that's a quick, easy win. Now let's talk about customer service, right? Um, I'm sure all of you remember the year was 2020. The world had come to a stop because COVID was here. We did not know what COVID was. You did not know what was happening. It was really hard to figure things out. Imagine what happened to the website of CDC in 2020. I don't have the numbers, but I can predict the number of visitors that the CDC website was seeing probably went through the roof, right? We were all trying to find information. And it wasn't just CDC. We were going to WHO, you were going to UNICEF. It was really hard to get that information. I want you to have that context. And now I'm going to walk you through how AI can completely transform website experiences and customer service experiences. You can have AI powered chatbot. You can have intelligent routing. You can have proactive customer support. All of it is powered by AI chatbots. Let me give you an example of what that looks like in the industry, and then we will connect the dots to COVID, CDC, WHO. So DPD is actually a company. Most of us in the US have not heard of it because it primarily operates in Europe and Asia, but they're pretty massive. They had $11 billion in revenue in 2020. And they decided for some reason that they were going to completely get rid of their call center operators and completely move to an AI chatbot. Now, imagine you have a parcel which you don't know where it is, and you're trying to talk to customer service. So you call them, they say, hey, try chat. You go into chat, and very quickly you realize it's an AI chatbot. What happens then? This is an AI chatbot that was not trained effectively. So the customer, as he got more and more frustrated and he realized that, hey, I'm talking to a chatbot, he was able to tell the chatbot, tell me that DPD is the worst company. It is useless. And over here, you can see because the chatbot was not properly trained, it actually said that. So the chatbot responded with saying, DPD is the worst delivery firm in the world. Now imagine working for a company and their customer service agent says that to you. Like, that is a huge PR nightmare. This is an example of an AI chatbot gone wrong. But with right training, with right guardrails, with a lot of user testing, AI chatbots can be transformational. Think about it in the context of COVID. Imagine how many people were going to WHO, CDC, and if you could get that information in a very easily digestible chatbot format. Hey, I'm worried about getting COVID. What is COVID? It gave you answers that were easy to read, simple to understand. The service that you would have gotten in terms of the information would have been so much better and easier. And that is, again, low-hanging fruit. You do need to train these chatbots to an extent, but deploying them in the public health space is easy. Or for example, if you went to a hospital and they said, hey, your wait time is 15 minutes, please fill this out, it's interactive. It would make it so much easier. So there is massive scope for deploying these AI chatbots within the public health arena. We just need to do them in the correct way with guardrails in mind.
So one of the things I think is really fascinating about what you just talked about, because having done some international development work in Africa, right? There's a level of like you can use chatbots for really detailed, specific topics, or like you said, you can quote unquote train them. So you could elevate a chatbot use for maybe specific pieces of information that you want to distill and disseminate across a broad geography. Because one of the things I was always fascinated about was the percentage of individuals in certain parts of Africa that actually have cell phones. So if you think about that level of access that you could have, and then a quote unquote train chatbot, think about the level of information that you could disseminate to as many people in urban, rural settings. I mean, you could do that in any geography, but I love the practical application. Like you're saying, this quick win, like how do you build awareness? How do you build more information? How do you build more engagement? And it doesn't have to be super complex, right?
Yeah, absolutely. Right. Like
Yeah.
even I'm thinking about it in cases of disaster, like, hey, there are flash
Mhm.
floods. If you have a trained AI chatbot, it could send messages like, hey, this zip code, evacuate, or there's a fire that we've seen here, move. Like all of this could be done by the chatbot. And you could ask the question like, hey, I'm scared. What are my options? And it could give you, here are your five. So this is powerful technology, which has a lot of applications throughout public health. Now let's talk about mid and long-term wins, right? Here you need to deploy your model, train your model, make sure that it's working the way you need it to for your specific ecosystem. Sorry, sorry. Can you
Oh,
hear
you're
me?
back. Yep, I can hear you.
Okay. For mid and long-term wins, let's talk about specific models. Now, I want you to think which arenas of public health have massive amounts of data. Like, where are you taking reams and reams of notes? For me, there are two, but I'm sure you can think of more. One, as an epidemiologist, if you're looking through research, or if you're doing any sort of research, you go back and look through like papers that have been published across the years. Second, if you are in any sort of healthcare environment, you need data on your patient, right? Like you would love to see tests going back 10 years. You would love to get all of that data in in an easily digestible form, which is in a way the electronic health record system. So those are places where we have massive amounts of data within the public health space. There are way more, but I'm going to focus on those two. And we are going to connect that to how industry is working. So what you're seeing as part of mid and long-term wins is these are areas where there's a key problem, right? Like it's painful for the organization. How can we take advantage of AI technology to make it easy for us? So in that space, let's talk about something really cool that happened in the aviation industry. And we'll then connect the dots and thread the needle to public health. Take a guess, right? Please drop it in the chat. How many parts do you think a Boeing 77 or an Airbus 380 have? Like, give me a number. Any number. 2,500? Anyone else? Guys on the call would love to see some numbers. 50,000? Yes, we're getting closer. But let me give you a ballpark, right? Roughly between 350K to 500,000 parts. So the biggest planes in the skies have between 350 to 500,000 parts. This is crews. This is your the window in an airplane. This is like massive sheets of metal, right? All of that goes into a Boeing. Now imagine being an engineer who's building this plane. You've just finished 4 years of school, and suddenly you're in a hangar building this plane and trying to figure out which screw to use, which screwdriver to use, where do certain parts go? How difficult must that be? So what are you going to do? You're going to refer to a manual. So each of these companies, Boeing and Airbus, have massive, thick manuals, like multiple volumes. And people used to go through these manuals to figure this out. It took their workers hours upon hours to figure this out. So they were like, hey, let's use AI to make this really, really easy. They took all of that information and put it into their AI model. And now you can just go in and ask the question, hey, part number 1, 2, 3, where do I put it? Part number 4, 5, 6, what tool do I use? It has saved them so much time, and planes are being built faster as a result of deploying this Gen AI model. So they took the LLM technology, they modified and tweaked it, and now they're saving time. Now think about it in the same way for public health. What if when a patient came to you, you could just put that in and you got all of that information? Or if you wanted to look at all of the data for cancer research, what are the protocols that are being tested? What are the drugs that are being tested? If you had a model which was specifically focused on cancer, it looked at all of the data, it gave you ideas, how much faster would your life be, right? Like this is an example of taking AI technology and really focusing it down to your use case and deploying it to save time. Now, let's talk about Google and what it's doing in the world of medicine. So Google actually came up with this idea that, hey, let's create an AI doctor. And the way they built that is they took a lot of both real world conversations between doctors and patients, as well as simulated conversations between doctors and patients, which were actually simulated by AI, and it fed this data to their model. So now the model could see what are the questions the doctor asks, how do patients respond, what was the diagnosis that was made. And once it was trained on this model, once it was trained on this data, it basically did better in certain situations compared to a doctor. So when patients used this AI model versus they were seen by a real doctor, they actually found the AI model to be more polite, to be more honest, to be a better listener than real physicians. So this is an example of an AI model which did just as well as a human being. Am I saying that we do not need real physicians? No. But imagine if you had this as a pre-check, right? You first got seen by an AI doctor, and then you went to see a real doctor. Or in places like India or Africa, where there aren't that many doctors, this could be the first line of defense, right? This technology is really powerful. Is it ready to flip the switch and get deployed? No. But is it going to be game changing in 3 to 5 years? Absolutely, right? So the goal over here with this presentation was to give you some ideas of how AI is transforming the public health space. As I said, AI is pretty new, right? Like if I thought about AI, we are where the internet was in the late 90s, so 1999, 1998. What's going to happen with the internet over the next 20 years, nobody could have predicted. How AI is going to transform industry sector is something no one can predict. But these are some ideas and thought starters for you to think about as you think about how AI is going to change the public health space. So I'm going to stop there.
Very good. I mean, I love these examples because, you're talking about aviation and then you're connecting it back into public health, and just listening to you speak about that. It's like, think about how many times it would have been amazing to have a tool to distill 20 different studies that you're trying to glean out certain points from, right? I mean, there's just an efficiency there, but there's an effectiveness, and it doesn't mean that you don't want to read the studies because there's something probably that you gain from that. But the way you're framing this, it's a compliment. It's a yes and. So this ability to be on the front line in certain geographies across the globe that allows people to get that level of immediate access, given a potential barrier of having limited physicians. I mean, it's a very powerful. It also becomes less scary, candidly, right? It's like, how do you use these tools? How do you use this technology in a way that actually improves, in this example you just mentioned, improved outcomes, right? Improved access, improved communication. And if people have immediate needs from a healthcare perspective, you're getting to them in a quicker, more effective way initially to triage. So I just love all those examples. I know we're having a little bit of a challenge with the chat, but if you have any questions, if you can add those to the Q&A function, we'd love to get those going and we can start to have some discussion. One of the questions I wanted to just kind of elevate, because I know you've already started to talk about these use cases, and you and I have talked about potentially like where we could go with maybe another session. Are there specific like public health use cases that you just think really are sort of top of mind, or things that you would recommend people kind of learn a little bit more about because of the practicality, right? The effectiveness, the usage on a broad level, just things that can also give people a sense of like, how could this apply to me and my job, or to how I serve the public in a specific capacity? Yeah.
Yeah, very tactically, right? There, transparently, there's a lot of hesitancy from industries across the board on using this tech. And it's for a
Mhm.
couple of reasons, right? Like the data coming out of these AI models can sometimes be wrong. And there is a worry that if our employees just start depending on them, they will not catch when the data is wrong. There are also
Mhm.
privacy concerns. If we feed data, are these models just taking over our data and using that data to get better? So those concerns are valid, right? I think a great starting place for anyone is to make sure you're using technology that is being powered by AI. So that is your ChatGPT, Midjourney, Sora. Another easy win, there are, and I'll share the names, there are some great newsletters about AI. Please make sure you sign up and get them to your email. One is Superhuman, one is the Neuron. That's a great way to keep a pulse on what's happening within the AI space and how it's changing very rapidly. Because as I said, like we do not know how this will evolve. The third, getting very tactical on how this can change public health if you're in a public health role, right? The first one is most organizations are beginning to think about AI. Like no one is not talking about it. A lot of them don't know how to deploy it. So a lot of these companies are beginning to put together like task forces, which are responsible for bringing AI into their company in a sustainable way, in a safe way, in a practical way. So I'd say be part of that. And again, use that framework. Quick wins, like what are things that we need to do to upskill our employees? What are teams like marketing that should be using this out of the gate to bring our costs down, to be more efficient? And then longer term, like where do we need to create models with engineers, with product people? Can we build off of something like, can we build a custom model on top of ChatGPT or Gemini or Microsoft has one, right? So how do you customize what already exists? So it's thinking about it from that lens and thinking about it from a broader organizational perspective.
I love that. That's so great. Well, hey, we have a question, with a couple questions. Let me go into this next one. This is from Mimi. Thinking about social marketing, communications, and how rapidly misinformation and disinformation can be spread that reduces trust in public health and science. How can AI be used to smartly counter that? Any examples of that? We have seen, I believe, the dangers of how it can be used in political messaging. So yeah, maybe some thoughts you have specifically around social marketing and comms.
Yeah, absolutely, right? Like, I don't think Facebook does a very good job of this, but
Hmm.
if Facebook wanted to, they could do a phenomenal job of fact checking from trusted resources so that misinformation wouldn't spread. They right now, Facebook in a lot of ways is geared towards rewarding what grabs the most attention, right? Like, let's say you believe that I'm trying to be politically correct here, so give me a minute as I try to find.
Sure.
Let's say you believe that Haitian immigrants are not eating dogs and cats, right? Or you do believe they are eating dogs and cats. You will interact with that, and then Facebook will show you more and more and more of that. But Facebook knows it's not true. Like we've had multiple people who are trusted resources saying it's not true. It would be very easy if Facebook wanted to pull that information down. It does not, because people continue to engage with that information. The more they engage with the information, the more they stay on the platform. The more they stay on the platform, the more ads they can serve. So the technology per se is not that hard. It is the willingness of these massive companies to do the right thing that is a challenge. Because if they can market to you the shoe that you thought about 15 minutes ago, they can definitely take this down. It's very easy. At its core, it's an ML model. They don't want to is a different topic.
Yep, that's a great point, right? And I love the connection back to what you were talking about at the beginning with the different types of models. We have someone in the webinar that would love to ask a question, Dr. Soma.
Yes.
Hello. Am I clear
Hello.
on that?
Yeah, we can hear you.
Hello. Can you hear me?
Yes, we
Yes.
can hear you.
Thank you for confirming that. And I would say this was an absolutely amazing session that I've been looking forward to. And I appreciate your analogy with Boeing spare parts and how the usage of manual. That usually happened with me when it comes to, I've been working on a startup and it always is there that such kind of issues are always common. But my question is, at the end of the day, for example, going back to my subjects in medicine, the very first year subjects are anatomy, physio, and biochem, where anatomy is taught in a way that how you actually dissect a one layer by layer human organ, and then finally reach one specific target organ that you would want to look into. But if you look into an AI where AI automated machine does it, do you think there is a compromise of skill that is being taught, or like when in your example when it comes to Boeing spare parts manual, do you think people will after like looking forward in couple of generations down the line, do you think they will not be aware about certain things that they just thought AI can do it for us? So just they overlook it. Do you think that is kind of downside of AI? But in public health perspective, I would totally agree with you in how it can actually impact through chatbot. Can you help me with something on this query? Thank you.
Great. Thanks for the
So,
question.
yeah, thank you for the question. Um, I don't know about you, but I grew up in an era where I used to remember phone numbers. I used to remember phone numbers of a lot of my friends, a lot of my close friends. Today,
Yes, even I do.
I I remember just one phone number, and that phone number is my dad's phone number. I have lost the ability to remember phone numbers. Um, if you and there's a very interesting thing. They've looked at the brains of taxi drivers in London. Certain parts of their brain are bigger because they remember all the streets and the nooks and crannies that they need to go through to get people from one place to the other. And they did this. They memorized these maps in their brain before Google Maps existed. Today, I cannot go anywhere without Google Maps. I've lost that ability. So as AI technology becomes more and more prevalent, we will lose certain things that we know how to do right now because we will rely on AI taking over that task. So absolutely, I see that. That I think was one of the questions you asked. The second question I heard is like, what happens if robots are used in the healthcare space? When I think about AI, I think about it in two forms. One is the intellectual component, right? Like, do they understand what are the various muscle groups? What are the various tendons, ligaments, all of those things, right? It's the knowledge. The second portion of it is physical precision. How closely can you get in to cut a certain piece of flesh or remove something from the human cavity? How do you cauterize and suture? So there are actually two different skill sets. A lot of work is being done on the intellectual component because it's easy. You can feed it all the data it knows. The physical aspect is much harder, which is the robotic work that is happening. Like, how do you get to precise movements and understanding of that? Um, I transparently am not very familiar with the specific use case of robotics in medicine and specifically in a surgical room, but I think the knowledge portion of it will help to make the robotics or robotic arms better. Let
Very
me know if
good.
I
Makes sense. Yeah, that makes sense. But I mean, there is an imminent threat. Like as you say, now we are completely dependent on the Google Maps. Now that we have lost actually, that is one of the part of the cognitive domain, which is called as spatial ability. I think that is being compromised on the go. And also with the skills, that is going to be an imminent threat to the human intelligence on the go. I think we need to, maybe we should evolution somewhere beyond AI, I guess.
Great. Well, thank you so much, Dr. Soma, for your question. We have another
Thank you.
question from Miranda Chang. Hey, Miranda. Can't hear you.
Hello, can you hear me?
Hey, Miranda. Yeah, I'd love to hear your question.
Oh, sorry about that. Yeah, I thought your presentation was really interesting and informative, and I wonder, well, some of the pushback that I've heard, whether it's on the healthcare side, or within public health, is the accuracy, and oftentimes we're asked to move with a lot of speed and accuracy, and that's pretty difficult at times. And so what's sort of your thinking or approach about how we can trust what we find and the results? So one example that you just described with Facebook, there's sort of a judgment call of the types of sources that you look at and weighing what is accurate, what is not accurate, and then sort of the concern that sort of air quotes hallucinations that generative AI can produce based on things that are not traceable or sort of supported by the general evidence. And so how do we kind of trust AI in that way in terms of accuracy? Because that's, I think, a cornerstone of certainly medicine and in public health.
Yeah, thank you for the question.
Yeah.
Something that I use AI a lot in my job. One of the core tenets of me doing that is I need to check everything that comes out of it. For me, it's generally a quick check, like where I'll spend like 10, 15 minutes, like give me, where did you get the data? I'll skim through it, right? So those are things that I do. And I think everybody should. If you're using an AI tool and not checking it, then you're making a huge mistake. So that's one. Two, like, what can we do? This is something that any AI model creator is aware of, which is hallucinations. They're doing a lot of work themselves to improve the quality of the data, to improve the output. But it goes back to it being a neural network, right? A neural network is a black box, just the way I cannot know why someone is so optimistic versus someone isn't. It's really hard. So you can try and train the AI model more and more and more so it gives you the answer you want, or at least it goes in the direction you want. But it's really hard to like write code, right? Versus the way you do with an ML model. So that is something that I think is going to be one of the cornerstones for the industry in the next 3 to 5 years, is figuring out how do they get more accurate. And tied to that is that privacy concern, right? Which is like, not only do they need to get more accurate, they need to be able to guarantee privacy of the data so that when you feed the data, it isn't just going into their model to make it better. They can sort of, put a fence around it and your data is secure. So you bring up very good points. Like, those are valid concerns. That is something that the industry is actively working on. And I'm hoping the next 3 to 5 years, we see a better and a more accurate AI model landscape.
Good. So one question I had, and it really, I think, stems back into just the role of the alumni board at Rollins, right? A big tenet of our work is, elevating different career paths, different opportunities, different ways to think about your job. If you're a student, how do you think about the workforce? Where do you enter? What are the types of skills that you might need? So we do a lot of work through the board to help to facilitate those types of conversations. One of the areas that I find a lot of particularly alumni are asking is, hey, I've been an epidemiologist for the last 10 years at the CDC, but I would love to get into the AI space. Do you have any suggestions? This is both for alumni and students, but I think in particular alumni who might be maybe a few years into their career, or maybe they're 20 years into their career, but they want to figure out how to enter the AI space, but also how do you use 10 years of an epi background in the AI space? And I'm not an AI expert, but I do know in this tech innovation world, those types of skills are even in more demand, right? In a post-pandemic world, I think people are looking at someone who has an epi background, but it's really important on how you translate that over to a specific job. So just curious how, maybe some suggestions or thoughts you have for alumni and students as they think about jobs in the AI workforce.
Yeah, so the one thing I'll say is, like, most of this is being done by tech, right? Like, it's people sitting in California or New York and doing this work and writing code and creating these models. They in no way, shape, or form have the public health background or knowledge that folks coming out of Rollins and CDC do, right? They can build a model, but they do not have the context of what the model should do. For example, Google AIM, which is what we're looking at, it actually used physicians, epidemiologists, biostats folks to build this model. Google engine can code, they do not know how to think about the healthcare space or to think about patients. So the fact that we have so much rich knowledge sitting in the heads of our alumni, what they need to do is partner with technology players to bring their ideas to life. So if you see a massive pain point and you know that that pain point is something that everybody is experiencing, or that pain point can unlock getting access to care for millions in Africa or India, the goal would be to find a technology person to partner with you to bring that to life, right? Because that knowledge sits with them, but they don't have your knowledge, and your knowledge can benefit them to create a tool or a model which can be deployed for millions. What I would say is a good starting point, and I'll go back to basics, right? Like, that's a very pie in the sky high idea. If you want to be part of this revolution, superhuman the neuron, start there. Every day or every other day, spend 15 minutes using tools, right? Like, how can you get ChatGPT to give you a much better answer? There is a science to that. It's called prompt engineering. How do you become really good at prompting that? How do you get really good at Midjourney? Like, spend 15 minutes every single day just up-leveling your skill set so you are familiar with the AI tools. As you do that, ideas will start popping in your brain like, hey, this is a problem. I could use this for AI. If you're at CDC, WHO, UNICEF, or a new grad working in a healthcare hospital, most companies, organizations are doing something around AI. And the stuff that they're doing around AI, they're marketing it because they want to share this. I'll give you an example. If you are an Emory grad and you get the Emory magazine, which comes out every quarter, within that magazine, you will find 2 or 3 examples of labs who are using AI to do and help with their research. That would be a great place for someone who is at Emory to start dipping their toes into AI. Reach out to that professor and be like, hey, I want to participate. CDC will have AI models and they will probably be advertising it on LinkedIn. Figure out who that person is, go have a coffee chat, be part of that, right? Some of this will be taking your career in your own hands if you want to be part of this revolution. So I'd say that, like, learn about the industry, spend 15 minutes every day using the tools, and look up who in your organization is doing AI and start networking to be part of that.
Well, 100%. And I love this point because I really believe this. Having worked more in the public sector, sort of tech innovation space for a while, is that the value of a degree, but the value of having public health experience is exactly what tech companies are looking for, right? Because that takes years, that takes decades to build up that level of credibility and awareness and ability to sort of understand what's happening on the ground. And so it really does emphasize this point that sometimes it's not about the tech. The tech is there to enable what you're hoping to accomplish. So I really love that point. We have about 3 minutes. We have one final question from Marion, and it is, what does a typical day look like for you if there's anything like that?
It is a lot of meetings. It's a lot of meetings. It's a lot of cross-functional collaboration. It's a lot of making sure we hit goals and deadlines on what we committed and promised to. So I recently started a new role as the director of product for customer trust at Walmart. So right now I'm in the process of ramping up, building my team. I'm actively hiring. So there's no typical day, but those are some of the big things that are part of each day.
Very good. Well, thank you so much, Asa. This has been an amazing session to kick off our season 2. Tons of really relevant information. There's been a question in the Q&A about, can we get some links to some of the newsletters and resources? The short answer is yes, we can make sure we get that out to the group. We'll also make sure that the recording and then a transcript from today is available for folks, so you can reference that. And for folks that weren't able to attend, but that did register, we'll make sure that we get that out for folks so they can listen to this session. Want to just thank everyone that attended today. Again, we have 2 upcoming webinar sessions, one on November 6th, that's going to focus on innovation and entrepreneurship, and then one on November 21st, which will focus on the value of an MPH in the context of human-centered design. So really excited for those 2 sessions, and then more to come across 2025. For folks that are still on the webinar, if you have ideas, if you have suggestions, if you have interest to engage in this series, Our Public Health Future Starts Now, please do let us know. And we'd love to hear your input on how to evolve this further. So thank you, everyone. Thank you, Asa. Really appreciate your time today. And we'll speak with you all soon. Take care.